and all had a chance to study what Dr. Paul Lam in Australia has also written on the subject. And so if you haven't done that, you may want to check on YouTube. Dr. Paul Lam has written and performed and actually tested Sun style Tai Chi, Yang style Tai Chi, Chen style Tai Chi in his clinics. And so a lot of what I will be teaching today is partially based on his study, which we have found that certain styles of Tai Chi are more appropriate for health and wellness. Okay, and both is easier to learn, better for the student or patient. What I will be doing today is introducing you to some of the techniques that you can use for yourself, but also that can be used for your patients. So that's kind of important. So there's a couple of things that I want to remind you of, and then I'll talk a little bit about the theory behind what I do. What I will be teaching today meets the CDC requirements, which is that the movement first cannot do any harm, number one. Number two, it is evidence-based, so it has to be tested with data. Number three, it is easy to do, easy to remember. How should I say, something that can be done almost anywhere. So what I'm teaching today meets all those basic criteria. I will also teach them at different levels. Okay, so that's basically what we'll do. The class will give you some tools at every different level. So Tai Chi, I should explain a little bit, is actually taught in several different levels. And if you've had or learned Tai Chi before, you've learned it on one level, meaning that most people have learned Tai Chi Chuan. Okay, that's the most common. Tai Chi Chuan, whether it be 24, 32, 88, 108, those are all Tai Chi Chuan, meaning they're originally created for one purpose, for the purpose of combat, and have been passed down for generations and generations. However, medical Tai Chi and Tai Chi Qigong are quite different from those particular forms. Those forms, as I said, were designed for the combatant to actually use. So there are a large number of techniques, and many of them can or cannot be good. Things that require you to go real low, real deep, for instance, shake your body. All these things can, at a more advanced age, be not so productive to your health. So I've taught both Yang style Tai Chi, Chen and Sun, and Fu style Tai Chi. So I've had a chance to see how that affects students. When I taught at City College, we have about 500 students a year go through our program. So I've had 25 years to study it because we've had to take and keep track of students' progress. So what I'm teaching, again, is a result of that observation and from the data that we receive through teaching these classes. So that gives you some idea of what we're doing. So let me move on then to explaining the next part. So for something like arthritis, of course, is caused by, it can be caused by inflammation of the joints, of course, aging. All those things result in deterioration of the joints. And unfortunately, as we get older, wear and tear takes a lot out of the body. So right now, Western science has some ways of dealing with it. They give you shots in the joints, number one. Two, replace the joints. However, as one of my disciples pointed out, while that's good, nothing they replace it with or the pills they give you will ever replace what the body gave you originally. And so part of what we're doing in this class is try and keep you with what you have originally for as long as possible. All right, so I think that's the kind of where we want to go. So part of it is in realizing, especially if it's inflammation of the joints or the joints beginning to wear out, you still want to encourage students to move because movement is life. That's what the Taoists always say. So we don't want to have people with arthritis or deteriorating joints to not move. They need to move, but they need to move, however, in a way that will not harm their body. Number one. Number two, will strengthen their body, increase the range of motion, reduce the inflammation, possibly even do away with problems that they have with aging and deterioration of the joints. So part of the study that Dr. Paul Lam has done showed that the techniques that he chose can actually help both to cut down on the help prevent people from getting arthritis. I haven't had it yet, but also ease the pain and condition of people who already have it. So that's kind of important. So part of it, of course, I've tested with my student. I should also mention, I had to test it on myself. So I've been as you can kind of tell, I've been an athlete my whole life. I was trained in Wushu. I also trained in Tai Chi. I've traveled all over the world, performed and competed. So my body's taken a lot of beating. So in my early 50s, I was already told, you have arthritis, you're gonna have to replace your knees. So at that time I decided, no, I'm not gonna do that. I need to find another way. The other way was learning Tai Chi. So I've held off having knee surgery now for about 20 years. So some of what I've been teaching is important. It's also important to realize, however, that as you advance in age and your patients advance in age, there is less that your body can take instead of stress. You need to train in a more intelligent way, make use of what your body can do, but also train in the original way of teaching Tai Chi. So I say that because nowadays, most people in learning Tai Chi, you learn a form. So I've talked to lots of acupuncture teachers and Chinese medicine practitioners. Many of them have learned Tai Chi. Almost none of them prescribe it to their students. And I've asked them why not. And not their students, but to their patients. Most of them tell me because one, they don't know how, and two, they practiced it only because it was part of the licensing. So for those of you here today, please realize that Tai Chi and Qigong is another modality in traditional Chinese medicine, but it comes from a different way, meaning that we use the movements of the body to help the body heal. So that plus how you breathe, the ability to both focus and meditate, all those things occur. So you can separate these things into separate parts, like you can do meditation, you can do exercise, PT type exercises. You can do it that way. But Tai Chi provides you a full body way. Every movement requires you to use the whole body, focus your mind, be meditative, learn to relax, learn to focus. All these things occur through the practice of Tai Chi. So you don't need to break it up into different little parts, okay? So that's what we're going to be doing. The other thing, I've divided Tai Chi up into several different modalities. So number one, we call it Chansu Gong. Chansu Gong is an exercise from Chen style Tai Chi, originally used for developing martial art power or Jin. The purpose of these is to what? Loosen the joints, okay? Coordinate the body and the joint movement. And also what? Learn to not use your muscles, but to relax and rely on your tendons and your ligaments. I will introduce these techniques at different levels. So there's going to be easy one that for elder students and patients, that's what they should be doing. We will introduce also the more difficult ones for those who are in better condition. And keep in mind, that's one of the nice things of Tai Chi. I can differentiate the range of what I do depending on the patient. All right, so hopefully that will give you some idea. So that's Chan Su Gong. After the Chan Su Gong exercise, we'll introduce what I call Dan Shi practice, Dan Shi Zhang. Dan Shi meaning what? A single movement from Tai Chi that you can practice by yourself, and just that one technique, so that you can improve the feeling and the flow of your energy, relax your body. Not so complicated. Then at the next part, I'm going to also introduce movements from the Tai Chi ruler, because I'm a proficient and a big fan of the Tai Chi ruler, which I'll explain later how that works. And then at the very end, we're going to introduce a short Tai Chi form for people who want something different to do. So keep in mind, Tai Chi can be, how should I say it, a chore, because, oh, it's so repetitive. We're going to introduce a form for those who are somewhat younger, more capable, who want something to challenge themselves. This will give you something to challenge yourself, but again, will not do any harm to your body through its practice. It will also be a way to remember the forms, the different movements. So originally understand that's what the sets were for, to help the practitioner remember what all the different movements and techniques are in their style, because they have to learn how to use them. So anyway, that's what we're gonna start with. So if there are any questions, please ask later on. I hope that makes some sense to all of you. And certainly these are, how should I say, result of my own study. And also, like I said, realize that what we know as Tai Chi practice nowadays is not the same as Tai Chi for therapeutic reasons and for medical reasons, completely different. And so you do not teach and use those same things. Instead, the Qigong practice and the Gong practice, so there are different kinds of Gong practice that can be used from Tai Chi to improve people's health. So first of all, I'm going to start off today, and Mason is going to assist me. You know Mason. He's going to take you through 4 sets of Letso Gong. Letso Gong are movements to relax your body, can be done by anybody. And so if you're ever in Chinatown, you'll see the ladies doing it as they're waiting for the bus. The general rule is practice it 250 times a day, and you will prevent 1,000 diseases. Okay, so that's what the doctors in China have said. Okay, so these are easy to do. You can teach these to anyone and practice yourself. It's a good way to get started. So one thing about these movements, and it's also true for Tai Chi, you only use force in one part of the movement. The other time you relax. It is not true that you're a wet noodle all the time, you know, like limp, okay? So in practicing these, you push back, but you allow your arm to swing forward. You do not push back and then lift your arm back up. That way, you're only using the physical part of your body. You push back, let your body relax. It will move by itself, okay? So that's important to keep in mind. So if you don't want to do 250 at once, you can do it in, 50 intervals, different times. So when we finish today, this is something you can put into your own practice, teach your patients right away. These are good for what? General health. So here, let me have Mason take you through Chan Su Gong, not Chan Su Gong, the Letso Gong in 4 different variations.
Okay, so first we're going to begin. You can stand if you'd like. For those who are a little bit more tired out by standing for good periods of time, or if you're working with a client that can't stand, these can be done while sitting down. But I'm going to be mostly for the exercises today, standing in a Zhangzheng position. So my spine is going to be straight. My tailbone is going to be slightly tucked in. My knees will be bent, as you can see here. And this is your Zhangzheng standing position. For those who joined us before, welcome back. And again, happy to be practicing with you today. All right. Also, please feel free to use the chat feature to ask any questions. And for any follow-up after that outside of the realm of what we're going to discuss today, please feel free to forward messages to our email at taiji@ucmap.org if you have further questions. Now, starting in your Zhangzheng position, as I mentioned, relax, bring your hands forwards, and let them drop. Let the weight of the arms carry your arm back down. So this is helping, again, as Sipu mentioned, start your practice. It should be incorporated with your clients if you so prescribe these for your therapeutic Tai Chi. All right, so just let the arms go back, relax the arms, drop them back down. And if you're curious about how many you can do, a good measurement we say is target a multiple of 3. And you could use, because it's easy to remember, it's easy to do. So you could do a set of 3, you could do 6, you could do 9, 12, and then you could break it up by sets. Say do 3 sets of 3, effectively 9 movements, right? So let's count down from 3 and then we'll move on to the next one. 3, 2, 1. Now try another version where one hand's going to go forwards and one hand goes back. So you're alternating. 1 and 2 and. Everybody's got that? So again, same thing. Let your weight of the arms drop and let the inside, your dantian region here, drop and come back up. Keep the knees and the feet forwards because this motion is small and can be done in a very compact space. So 1 and 2 and. So just like that. Okay. So for, again, these lots of gong exercises, they help you loosen out any tension in the body, get your blood flowing, and is good low impact exercise to do for therapeutic Tai Chi. And again, I'll wrap it up to move on to the next one in the count of 3 and 2 and 1. Good. So that's 2 versions. The third one, hands out to the sides. And again, you're going to drop the waist, but you turn inside with it slightly. And as you do, the hands go out to the corners. 1, 2, just like that. So 1 and 2. Okay. So very subtle turn. You keep the knees and the feet forwards. So this now adds a little bit more dimensionality. 1, 2. 1, 2. Good. So very slight subtle turn. And again, helps work out any tensions, gets your blood and your chi flowing. Good exercise, very efficient, very base conscientious. Okay, let's do 3 together to wrap this up. And 3, and 2, and 1. Good. As for the fourth one, we'll do, you could do this one where you make a gentle fist with both hands. You could tap the dantian point, which is again 3 points below the belly button. So you can do it yourself. You can measure there. And there's a corresponding spot that is where your spine connects to your pelvic bone, known as the Bingman point. So you can tap those. Same movement, but now tap, 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 tap. Okay. This time, again, you can just have your hands to the sides and just tap, 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 tap. Okay. Tap, 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 tap. So a little bit of a self-massage at the same time. Tap, 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 tap. And again, 3 and 2 and 1. Good. Now I always like to follow up with a little sugong. So relax. Let the hands come up to the crown of the head. Come down the center as you breathe out. Okay. So while we're doing these exercises, you will see me close through sections. At least I will do at least 1 sugong, but if you can fit in 3 between sections, that will work just fine. Good. All right. Very good. Yep. And again, reminder for those who are seeking certificate of course completion, please email info@collegetaichi.org, and there will be a tiny test regarding the class materials that will be involved with that. So there you go. Sipo?
So I just want to go over a couple of things that this class is going to cover. 1, it will increase the range of motion and mobility. 2, concentrate on improving circulation and breath. 3, improve mental focus and relaxation. Reduce inflammation and pain. And also provide tools from Tai Chi or Qigong as therapy for the patient. Okay, so that's kind of what we're concentrating on. And then remember, the CDC requirements are that the movements do no harm, is evidence-based, and also easy to learn, easy to do. So those things are also quite important. Okay. So we're going to next begin with some of the Chansugong exercises. As I was mentioning earlier, Chansugong, these are exercises from Chen style Tai Chi. They're designed in this case to go from the head down to your toe, opening each joint, improving its, how should I say, its range of motion. So that's quite important. Mason's gonna start with you from the head, and then we'll work our way down to shoulders, elbows, waist, knees, and then foot. So let me have Mason get you started on the head now.
All right, thank you, Steve. Okay. Couple of safety measures, of course, when you're working with your clients, is that as we're working on the head area, there'll be certain movements that will explain what's an acceptable range of movement. For this first one, you want to keep your face forwards. Okay, your neck. There'll be another exercise that we'll do to work on the vertical line, but this one's going to involve making a circle with the head and neck going all around. And it's okay to, again, let your head drop, go to the left, go to the right. But you know, right here, I'm excluding intentionally anything that brings the head back and up behind. The reason why is because I don't want to grind my spinal stem where the neck connects to the cranial here. We'll work on something that does the vertical line later. But for now, when you're working with your clients, especially if they have tightness in the neck or the the clavicles here or the upper chest, this exercise can help you with working out kinks, especially in front of the computer all day, as many of my own colleagues are. Okay, so same thing, you could do 3 sets of 3, 1 set of 3 if you're just introducing it, or someone is limited mobility. So you can prescribe what's possible. So let's do 3 at least together. 3, 2, and 1. And of course, let's go the other way. Relax the neck, let the eyes rotate even, and then go across. Down from the left to the right and across. Down, across. Okay. And for those who may be more physically apt, or if you're working with someone who is used to Tai Chi or Qigong, you can also encourage people to shift from one claw to the other. That's an option too. But again, you as the trainee or you as the trainer, as the therapist, should prescribe what you feel is appropriate for your clients. Okay, so let's do 3 together. 3, 2, and 1. Good. All right. Another one we'll do is we're going to go over the shoulders from right to left. So you look to the right side, you'll feel a very clear stretch along the connector here in your neck. Great stretch. Good for, again, working on the kinks. And then shift over to the left side. Same thing. You will feel corresponding stretch here. And you notice I am shifting. I don't lean, so I'm not extending too much. The movements we're intentionally showing you today should be minimal, easy to remember, easy to replicate, and easy to do. So efficiency is what we're working with here. So just a subtle shift over your right femur, a subtle shift to the left femur. And again, nice stretch from right to left. Right to left. And again, I'll count us down from 3 to before we do the next one. Good. So 3 and 2 and last one. Good. The last one I'm going to show you now is addressing the vertical line. Because this one is only on the vertical axis, you're not going to be as risk to injure or wear down the cranial stem. So this one I'm going to do it from the side angle so you can see. I look up and I feel the stretch along the vagus nerve. Again, my esophagus is, many of you are familiar with the Renmai, a line that goes down the center here. And then I go down. And you notice I bend the knees, I haul the chest around the back, and then I straighten back out again. Up and down. Up and down. Up and down. Again, let's do 3 together. 3, 2, and 1. Good. And closing that out, so go. Good.
Very good. Thank you, Mason. So next we're going to move down to the shoulders. couple of things that Mason mentioned is important. Tai Chi works by using what we call ground force. So this is kind of the theoretical discussion of it. As you know, when we're standing on the earth, there's a gravitational force that pushes up that exactly equalizes our force going down. That's why we stay connected to the surface of the earth. Should we press down with less force than the earth pushing up, we would of course fly off the surface of the ground. So we have to constantly keep it even. Now, if you notice, Mason did a couple of things. He pushed into the ground and pushed back up as he was doing his neck exercise. He's making use of that ground force. That is an important part of Tai Chi. Tai Chi does not work like Western medicine in the sense that we make the heart work fast and hard to pump the blood around the body. In fact, Tai Chi, we're worried about the other part, which is the blood pumping from your heart to your legs. How do we get the blood back? By using the legs. So Tai Chi movements must make use of what the legs are doing. So usually you do that by bending the legs and pushing back. Now, if they're of very advanced age, obviously that may not be possible. So then they do whatever is they can at their age, as long as they still continue to move. But I will explain later on some things that even advanced age people can do, or if you're seated, you can do, okay? So all these movements we're teaching can be done either way. But the legs are quite important. So for instance, the next one I'm going to do is the shoulder exercise. So for someone who cannot do anything with their legs, you can just, okay, do it up here. Okay, so that's kind of easy. These are shoulder circles, is for the shoulder. The two important features, the chest must hollow, back round, the back must straighten. So you're breathing in here and breathing out. Or if they're a little more flexible, they can bend down part way and come back up. If they're younger and in better physical condition, they can go much lower and then push off the ground and come back up. The last one is very hard. You do not prescribe that for someone who has advanced arthritis or advanced age, okay? The two beginning ones are much more appropriate for most seniors and most patients, okay? I will have Mason take you through it. So each exercise goes one way and then goes the other way, okay? So these are the shoulder and elbow circles. Mason?
All right, thank you, Sifu. Okay, so let's go ahead into our standing Zhangzhong position again, or again, you can do this from seated position. I'm going to start by having my hands in my Danjin region. I'm going to rotate up and down. I'm going to show you just two ways to do this. So here, my hands in the Danjin. I open up at the chest. I feel the sternum, my rib cage, and my shoulder blades open and then close. So open and close. So open, close. This is, you'll hear me say this a lot, one of my favorite exercises. So open and close, rotate. So again, 3, 2, and 1. Good. Now we've gone circling this way. Now we're going to circle forwards. So all the chest around the back, your yi, your intention goes down and circles up behind you over the top of your head and back down. Circle and down. Circle and down. Okay. And again, if you can, working with your clients, you can have them bend the knees slightly. If they can't, standing Zhangzhong position is just fine. 3, 2, 1. Good. And as Sifu was showing you, if they don't have that much range of movement, you can do it again from this position here. So small rotations of the chest and the upper chest and the shoulders. So having your hands near the Tanzhong point. Another way to do this exercise, as I said, I'm going to show you two. This is the second grade. So small circle. And again, based upon their athleticism or the age of your clients, there's a fuller version. Again, Steve said, crossing the arms, lowering the body, coming back up. Notice as when I do this, even for the movement that's larger, I'm not intentionally bringing my hands up. They're below the level of my shoulders. I come down. So again, whether they're doing a full body movement or localizing it, just the shoulders and the upper chest, just fine. So 3, 2, 1, and of course reverse. So same thing, rotate back. So again, rotate. You can give it a try. You can see again, keeping the shoulders relaxed and down. Let's count down from 3. 3, 2, and 1. Good. And good. All right, so back to you.
So that is a double arm circle. You may also do single. So let me demonstrate to you. I have my right foot in front, so you can, just working on my right shoulder, I'm rotating it backwards. Okay. So I lift the shoulder, rotate it back, and drop it down. And then you may reverse it by raising the shoulder up and dropping it forward. If that's easy, then you can go to a larger range of motion using the elbow. So here, I'm rotating the elbow backwards, rotating it forwards. So that's kind of a larger range of motion. But now you can also go back to this position and an even larger range of motion. So first, you may do it, and notice it goes all the way from the front of my body to the rear, comes up, comes across my body, and goes back. So that's a basic way. It's also a little more difficult. The more difficult way is this way, which is you go, and now I bend forward all the way down, rotate, come all the way back. Again, that's not for everybody. So you should make sure you understand where to apply this. Again, this is for younger patients who maybe have some athletic ability. It's easier to do. The two things to remember is, one, the legs have to move. So when I'm doing this, my weight goes forward, my weight also goes back, okay? The rocking back and forth helps to energize my body. So when I was talking about the ground force, as we push into the ground pushes back up. So as you're doing this, the energy in your body is going up and down, energizing your body. So this is an important feature of Tai Chi. Of course, if you're a senior, you may not be able to do that too much. But even if you're sitting down, you think about when we're doing these things, oh, I'm doing this one, I want to concentrate my leg, so the leg can press on the ground and then relax. Press down and relax. You can do that sitting in a chair. Same way is okay. So how you practice it, again, is important. The other thing that Mason mentioned is another principle of Tai Chi, which is Kai He. It's important to remember, you always have to close the body and open the body. All of this is, and the bending of the knees help to pump the energy and the blood throughout your body. So that improves the circulation of the patient, number one. And number two, it moves their fluids, helps regeneration process and strengthening of the muscles and tendons and ligaments. All right, so I'm gonna have Mason take you through all those exercises for the shoulder. So we have single shoulder and also single elbow.
All right, thank you, Sifu. So this one, again, Sifu said it's going to be a slightly different position. I'm not going to be in the standing position. I'm going to be in a bow stance. So there's, I'll do it from the side profile so you can see over here. Again, prescribe your as needed. I'm going to start with my right hand near my shoulder socket. Going to rotate forwards and back. Okay. From the front, it looks like this. Same thing, I'm keeping my elbow no higher than the shoulder. It doesn't go hiking up. You see the line in the room? Intentionally, you can measure how I'm doing. I'm not going above my shoulder. Okay, so. And I'm on the right side with my right leg. I am shifting from 60 to 40. So now there's 60, 40. I am changing subtly between where the majority of my weight is. Okay, so 3, 2, 1. Now you guessed it, I'm going to go backwards the other way. Rotate back. Okay. Intentionally, again, my attention needs to be on my elbow as it rotates around nice and smoothly. So 3, 2, and 1. Okay. Now you switch over to the other side. So if I had the right hand, right knee, left hand, left knee. So let's give that a try. So rotate forwards, rotate back. You see me from the front. See me from this side. That's 3, 2, 1. Good. And of course, reverse. Here. And lastly, let's count down 3, 2, 1. Good. So that'll do it for some of the working rotations through the chest and the shoulders. All right, Sifu, back to you.
Yeah, I forgot to illustrate one more, which is we did it forward in the Janzhong position. I will show you just the reverse once. So from here, allow the arm to drop down, circle up, roll it to the rear. Okay. And again, if you're at better range of motion, you drop down, come all the way back up, all the way back down. So this is a very large range of motion. Again, depending on the condition of your patient, you prescribe what is appropriate. What is it good for? You have tight neck, cold hands at night, okay? You have neck pain, maybe even a headache. All these things can be of assistance to alleviating those kinds of things. So we're going to move down now from, because we've done our elbows, I'm going to do the wrists and then the fingers. So the wrists, simple technique is just to rotate the wrists. You can rotate it forward, rotate it backward. So just relax and rotate, okay? More difficult, a little more range of motion. You use the entire body to rotate my wrists. Okay, so that's going one way, and then the other way, I have to lower and push off the ground in order to get the same rotation. So these things help with the wrist rotation, and then the finger exercises. Finger exercise, I'll let Mason show you all those. Okay, so these are for your wrists and your fingers.
All right, so let's give this a go. Again, I'll just show you what the kind of our medium range of movement. So again, standing from the Janzhong position, relax the elbows, circle around, circle in. And again, working with your clients, think about and help encourage them, your clients as well, how to relax from your core through the shoulders, elbows, wrists, and palms and fingers. So try to again feel like the limbs are in water. If that helps give you the analogy, and everything is fluid, connected, and flowing as one. Okay, so 3, 2, 1, and of course reverse. Hands go forwards, rotate around. Again, I'm intentionally just showing the medium range movements. As Eva said, if you wanted to work whole body, same thing. Just take the time to work through it smoothly. But again, most people, this is generally all you'll need. And most of the clients that you work with may have certain limitations. So today in our classes, we will tell you some of the ranges, but for exercises, I'm just going to mostly do medium range. Okay. 3, 2, 1. Good. Now, as Eva said, some dexterity exercises for your hands. Again, this will help hopefully offset arthritis, carpal tunnel, tightness of the fingers, and also for those who might be recovering from recent injuries or sprains to their hands and wrists. These could be good prescriptions. So you give it a try, see for yourself. We're going to start with 3 different versions. For this, your hands are just near your shoulders, and open the whole hands and close. Open, close, open, close. Extend all the ligaments of your fingers forwards and come back. So these are also good just generally for developing grip strength. And as many of you are here know, you have your channels and your acupuncture points that go to the hands. These are great exercises from a martial aspect of giving you some strengthening exercises too. So it depends on what you want. Okay, 3, 2, 1. Second one. Focus now just on the digits of the fingers. The 4 digits, close and open. Close and open. For those of our friends here who have done Eagle Claw, this might seem very nostalgic to you. It should. Very similar. Close, open. Close, open. Close, open. So again, sets of 3, repetitions of 3, good ways to start with if you're wondering about how many to go. Frankly, though, that's going to be determined by your clients and how much exercise you're trying to prescribe. So if it's 1 set of 3, great. If it's 3 sets of 9, amazing. But you have to tailor that for your clients. Okay, so 3, 2, 1. And lastly, palms and knuckles. So this one, we've done the full hands, we've done digits. Now we're going to focus on palms and knuckles. Close, open halfway. Close, open halfway. Close, open halfway. Okay. Close, open. Close, open. Close, open. So 3, 2, 1. And I always like to encourage, after doing such exercise like that, shake out the hands. Because you also don't want to build up tension. So help them relax and then still go. Good. All right. Super. Back to you.
Okay, so we kind of dealt with upper body. We're gonna move down to the mid-range. Mid-range has to do with your waist. So there's several different exercises. I'm gonna show one, Mason will show the other ones. This one, however, is rather difficult to do. You don't move your hips, you move your waist. So you relax, bend your knees, you're pushing into the ground, slowly turn, okay? So you notice my hips are not moving, just my waist and shoulders and chest. The upper body is moving. The head is actually not moving. The head stays launching in front. So this is good for what? Waist flexibility. Other techniques include rolling the hips and waist. I'm going to let Mason do those, but this again is for loosening the center part. And again, it's important because if you don't have flexibility here and mobility here, have a hard time moving. So and Mason, well, I'll talk about also other exercises you can do with this after Mason finishes. Okay, so let's have Mason take you through that.
All right, thank you, Sifu. All right, and also a good way to start those up, take your hands, bring them to your kidney points, give them a nice rub. Especially after having done the finger exercises, this is nice to pair up with that because your hands might be warm after doing that exercise. So you give them a nice rub, help energize your belt meridian here. Okay, and then let's see what was doing. So again, your hands are here in front of your belt meridian now. So turn, 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 turn. Press the waist, horizontal waistline, but my hips, knees, and feet stay forwards. My waist is turning on the inside. So again, you know the concept of the square and the circle. Your hips are the square, your waist is the circle, the waist is turning inside. Left, right. Left, right. And your hands can help caress the belt meridian as you do so. So 3 and 2 and 1. Good. Okay, now we're ready to do some those circles as Sifu said. I'm going to do 2. I'm going to do a big version, and I'm going to do a small version. So, and you can relax your hands at the sides. I like to have it on my hips just for feeling if I'm engaging my my danjian. So I like to sometimes tell people they can measure their own success by gripping here gently. And that way I'm also making sure my hips are staying forwards. So circle around. Rotate forwards, rotate back. And again, my knees, my ankles, my feet, my hips stay forwards. So here, actually, there's what I'm showing you. I'm making sure that my hips are staying forwards like this. I'm trying to avoid this. You're not trying to squirm away from a cheetah chasing you, so you don't need to do that. So that's why I am, again, just moving my waist. And it is a big circle, but it's limited on, again, what's helpful. What's your range before what's being helpful it starts being harmful. So that's why I'm making sure that my hips are forwards. Okay, 3, 2, 1, and let's go the other way. Let's rotate around. See? So again, hands on the sides, okay. Hands on the hips might be helpful just to help inform you and your clients what's going on. Okay. 3, 2, 1. Now, as I said, I'm going to shrink down just the circle to now be just on the inside of this Dantian region here. I'll put my hands here so you can see potentially. You might see what my hands are going up and down. Some people tell me that they feel like they're making a yin-yang symbol with their Dantian points. Some other people will say if you drop a plumb line from the top of the head, that it's making a small circle inside. Whatever helps you visualize or explain to your clients, utilize, please. But now you can see on the camera, hopefully, my hands are going up and down slightly. Again, I'm moving just from the innermost parts of the core. So 3, 2, 1. I've done one way. Now I'm going to go the other way. Okay. And as you know, this region supports your stomach, intestines, your kidneys, and your bladder all sit on this area. So this is good exercise to help with the flow that naturally goes on in your digestion. 3, 2, and 1. So same as before, 3 sets of 3, 1 set of 3. If they are limited on what they can do, you prescribe what's doable. So Gong, and then I'll hand it back to Sifu.
So again, these exercises are excellent for helping improve circulation, but also digestion and elimination. Because you're moving the organs, and actually by moving up and down sideways, you kind of shake things up inside and help the body improve its regeneration and digestion and circulation processes. So quite good for that purpose. Next, we move down to the knees and the ankles. I'm only going to do a few because some of these exercises, the more difficult ones, are actually not suitable for people who have arthritis. Generally, you notice, I've talked about big movements and small movements. The smaller the movement, the better it is for people who have acute arthritis or have pain already. Small movements, but still, they're able to manage these movements. So as if you do prescribe these, ask the patient to monitor themselves. They will be able to realize how much they can do. So again, as I said, I have arthritis already, but you notice I can still do many of these movements, but very gently and very carefully. So for the next one, you want to rest your hands on top of your knees, slowly turn, small circles, okay? So you go one way and then you reverse the other way. Okay. And so those are the simplest ones to do. Also, the other thing to emphasize, as you get to this point, your hands should be warm by now. You rub your hands together, rub your knees. So you rub your knees from up to down to help move the fluids down to the bottom of your leg and to help the fluids come back up your leg. Okay. So that's on one side, same thing, first going down, then reverse coming up, okay? After that is the hip and shoulder turn. So here, I put my hands on my waist, you know, as I turn, open my hip, open the shoulder, and then now I close, I bring it all back. Open and close. Again, this is to help develop your flexibility and your range of motion. But again, something that anyone should be able to do at almost any age. Okay, so I'm gonna have Mason take you through some of those. He may show you some a little more advanced exercises, but keep in mind, these are the ones that I recommend for most people. The other thing I should mention, if you're not standing up and practice with me, please get up and try these things out, because the best way you can prescribe these things is to try it yourself and see, you know, what it does for you. Okay, so that's kind of important. So take this opportunity to get out, move around with us. Thank you.
Thank you, Zipo. All right, so as Zipo said, we're going to start with the first one. You have your feet closer together, hands on your knees for support. Sometimes you might say, you give a little rub to get the blood flowing first. And let's circle. Now, if you're wondering about how far your circle should be, take a second, check how far your toe is. Okay, your knee should not go past that line of that toe. That is a good idea of your radius, maximum radius that you should prescribe or work with your when you're doing this exercise. So rotate around. Okay. And joints, as you know, knees can be troublesome regardless of what age your clients are. So we want to help strengthen, not loosen and weaken the joints. We want to strengthen them. Okay, so 3, 2, 1, and let's go the other way. So the hands on the knees are supports. Okay, they're both for protecting as well as helping give a support as you're doing these motions. 3, 2, 1. Okay. Next one, you can have your feet apart. About the width of the shoulders is plenty, and you can rotate in. So again, as Eva said, some of these movements are a little bit more dynamic. You can choose if they are appropriate for your clients. But notice again, my hands aren't here for support. Let's do 3, 2, 1, and now the verse. Let's go in and out. Same thing. My toe distance from my knee down to the toe is the maximum radius I want to work with, because you don't want to overextend the joints. And same thing as before. 3 repetitions is plenty per set. So let's go ahead and do 3 together to wrap that up. 3, 2, 1. And the last one we'll show is opening and closing the whole body. That is a good way to wrap up each of the Luxigong and spiraling Chansugong exercises we did. So from here, my weight's going to be over my left femur and hip bone, my left quad, and I'm now going to open up whole body to the right and come back. Open and close. Just like Sifu said, Kaiha is an important aspect here. So again, I'm just doing the right side. Open and close, like the hinge of a door or the spine of a book. Expand a few, each of my channels open up and then relax. So try not to force it. Let yourself do a small stretch if you want. And you can try that up yourself and see. Do you feel your fingertips? Do you feel your crown of your head? Do you feel the shoulders and the hips opening in time with each other? And just 45-degree angle turn is plenty. You don't have to go and I further than 90 degrees. Don't need to do more than that. So 3, 2, 1 last one. And the left side. Open up. So now all my weight's on my right quad. My left is empty. So you should be, if you're curious about what it means to be empty and full, I'm full on this leg. It means that I can put my weight on here. I'm empty on this one because that way I can lift my leg up. Open, close. Open and close. So again, 9 degrees is plenty. If they can only do 45, that's just fine. No 2 people will have the exact same body, so your prescriptions will not be the same as another client you may be working with. Okay. So let's count down. 3, 2, and 1. Good. And before, as we said, breathe. Sugong is a good way to close out a different section of the body. All right, very good.
So there are actually many other exercises that are part of Chan Tzu Gong, but these I think are the most appropriate, simplest to do, and the most basic one. So concentrate on this basic list. This will give you lots of tools. It can deal with, as I said, joint problems in any part of the body, back problem, neck problem, aching joints. This is all movements that can be done that will not make a patient's condition worse, but actually may in fact improve it. The other thing is you need to, of course, as I said, do it yourself so you get some idea how it feels. And as you teach them to your patient, you can ask them how it feels and get an idea if you need to adjust the range of motion or not as you're doing. So these are, as I said, techniques that you can use. You don't have to teach the patient the whole thing. You can take parts of it that are appropriate for their particular situation, which is the beauty of something like Chan Tzu Gong. So now I'm going to move on to the next part of the program that we're going to be teaching is this is Gong Fa. Gong Fa are techniques that originally martial artists used to perfect their technique. We're going to use it to help improve our health. So there are many different Tai Chi movements that you can use. Only some of them are appropriate for most people. So the ones I'm going to be teaching, most of them come from either Tai Chi Xing Yi Ba Gua, okay, so that's a big range, but a lot of it is from Sun style Tai Chi, okay. These movements generally improve a person's health, get their energy moving, are designed not to injure the student. So I'm going to show you at this moment 3 different ways to do, well, actually maybe more than that, of doing beginning Tai Chi. So basic beginning Tai Chi, everybody just goes like this and drops their hands down. There's actually more to the beginning Tai Chi movement than that. So let me give you some idea. So actually, even the beginning of Tai Chi is something you can teach to a senior who has problems balancing. So what do? You teach them how to step in and out of the beginning Tai Chi position. So first they have to sink into this leg, all the weights here. You empty this foot, step out, but now you notice I didn't step out and move my body. The body should not move. That forces the patient to what? Balance himself on this one leg, step out, and then slowly shift their weight back, okay? And actually for a basic patient, you can also have them lift the other leg and step back. And you can repeat this movement over and over again to develop their sense of balance, okay? And that's a good way to begin. So next, after you've done that, so you're now in this position, the most basic way to begin beginning Tai Chi is with the palms facing each other. So you come up to about shoulder level. As it reaches shoulder level, I bend my knees slightly. As I reach forward, I've straightened my knees. And now I withdraw by bending my knees, bringing the hands back. And now I push down. As I finish, I straighten my knees and my body stands back up, okay? So actually there are 4 different parts to the Tai Chi movement, beginning Tai Chi. So this is 1, coming up, okay? From here, 2, bending back, 3, pushing down, and then 4, straightening back up. All that allows the Qi to circulate throughout your body. So that's method number 1. Method number 2, sink into the ground, raise back up. Now this one, you notice my pinkies are facing upward, the palm is facing outward. So from here, reach out, draw the Qi to the Pangguan, to the temple point, and now from here, press down. Okay, and everything is the same. Again, you bend the knees here, raise up. Again, reach as far as you can, use your imagination. Draw the Qi. As you draw it back, you bend your knees. The knees are bent now. palms facing down, push down, straighten back up. The energy rises back up as you complete the movement. That's method number 2. Method number 3. Okay. Again, you bend down, lift. So this one is a little bit harder. You relax the knees, relax the arms. So here's the bottom of a ball, the top of the ball. We call it your chi ball. Bend your knees, roll the ball back, push the ball forward. Roll it back, push the ball down, separate the hand. So 3 different ways of doing beginning Tai Chi. So I'm going to let Mason take you through that, okay?
Thank you, Sifu.
Mhm.
So let's go ahead and give that a go. So for the start from the standing position. Okay. And relax. Hands come up. Back down. Up. And down. Up. This is beginning Tai Chi. We do 3 of those. Now the other version again. Turn the palms. Let's come up. And then make the circle. Yeah. And then extend, draw back, and come back down. Okay. Relax the hands, settle the palms, let the fingers, again, let your fingers point back down before you begin again. So this is the second version of how you can do beginning Tai Chi. Okay. Turn. Up. Relax the elbows. They're about the height of the eyes. Is plenty. Doesn't need to go higher than that. Extend. Down the center. Settle the palms. Relax the fingers. Third time. Turn. Come up. Breathe in here. Stand. Back and down. Good. And the third one is come up. It's gonna start the same, but this time relax the elbows. You make a whole circle in front of you.
Watching.
Back up. Again, relax the elbows. It's again like the ball's in front of you. You're rotating it. Extend out. Back and down. So that last one has the most movements, but again, still finishes by settling the palms, relaxing the wrists, so the fingers point down. So that again, you can see me from the side. I turn the palms up. Relax and see again. I make a circle in front of me. Go to the top of the circle. Rotate the circle in. Now. Go in and down. Last time.
Oh,
there's lots of mistakes.
Turn. Up.
It's so very fast cut of this.
Up. Rotate in.
Breakfast.
Then.
Okay, barbecue.
Good. All right. Very good. 1 second, please. If you have any questions, feel free to post also or type in the chat. But
Okay, so that is beginning Tai Chi. There are many, of course, other movements we could do. So we have a limited amount of time, so I'm only going to introduce a few that you can do. These all, again, concentrate on what? Circulating and using the entire body as you move. So as you saw, the more difficult ways engage more and more of the different parts of your body. Next one I'm going to do is the movement Ji or press. So you're standing here, you're going to bring the left hand inside the right hand. The hand circles, so now it circles in front of you vertically. Okay. And the hand stops in front of the Tanzhong point, your heart point. You press forward and now separate and dissolve. Okay. Left hand, same way, circle, turn, come up to the heart, press forward. Separate, okay. Withdraw, push. So there are many different movements here. Again, for a circle. So this movement we call G or pressing energy. Then separate, pull back. So this is withdrawal, and then push. So this includes the movement of push. These are 4 of the 8 energies of Tai Chi. So again, turn, this is both Peng and Lu. Here, G, separate, bring in, Okay, and again, you're doing it in Zhang position. We will be doing mostly what we're doing for this, stationary. There are moving ones that we can do, which I will introduce perhaps at another time, but for right now, these are, we will be doing mainly in this position.
All right, thank you, Sifu. So again, this is G, or press. Okay. So up, I'm gonna come up with my left hand, right hand's gonna go under. Press. Separate the hands, push down. Now begin again on the right side. Left hand goes under, right hand circles. So that my left hand's palm facing out, and it touches the inside palm of my right as I press forwards. Now remember, separate the hands, push down. Okay. Now again, left hand can be out here. If it helps you, because I know this movement can be a little bit hard to coordinate side to side, you can have your clients have your left hand go out and then bring their right hand underneath it. So from above, it looks like this. Okay. That might be a good way to help people understand how to start if they're not used to knowing how to coordinate the right and left hand. Separate them down. So likewise, I'm going to have my right hand up, left hand threads underneath, and I circle open. So that's another way that you can show people how to start that movement. So let's do a second time. Second time on the right side. And last time. And as I do this, you can also explain bending the knees. Okay, so the right hand's going to come up. Watch my knees here. And the knees, and then I straighten as I push. If you want to incorporate that aspect there too, you can. But again, work with your clients where it's appropriate for them. Okay. Hey, Steve, back to you.
So just to show you once from the side. So Mason did it one way. The more difficult way is keeping it very close to your body. So you notice my circle is completely vertical. You bend here, straighten here, separate, withdraw, push down. Okay, so those are all the details. Again, you start with where your patient's at. You may modify and change the movement as is appropriate. So again, what is this good for? Circulation, also coordination of left and right side of the body. And keep in mind, as seniors get older, they begin to lose contact with their body. They may not be able to coordinate both sides. So this is kind of a very important exercise. All right, the next one that we are going to do is, it's called brush, knee, and press. So how are we going to do this? So the hand is going to come across the face once, twice. I bring the hand back. Now, the hand is going to cross in front. And then when it gets here, this hand is pushed to the back. This one pushes forward. Then you relax. 1, 2. Again, raise the hand up. This hand brushes to the side. When it reaches your side, it pushes forward as the other hand pushes backward. Again, that's to do a maintain balance. Okay, so again, you start with, now that this hand is here, the backhand starts. 1, 2, oh, actually, no, I take that back. No, I guess you can start with that. Backhand goes 1, 2, and then you bring it back and then go forward. Okay, then 1, 2, bring the hand back and go forward. So this is brush knee and press. Let me have Mason take you through that.
Thank you, Sibo.
Mhm.
All right, so again, we'll do 3 repetitions on each side, so 3 sets. So I'm gonna take my right hand first. It doesn't matter too much on which side you start. Just know that traditional martial arts, they tend to be right-handed. There's not necessarily a intrinsically negative aspect of starting with the left hand, aside from just precedent. So, but I'm going to start mostly with doing the right side. So block with the right hand, block with the left. My right hand comes up by my ear and press. Relax the hand, block with the left hand, block with the right. Left hand comes up by my left ear. Press forwards. So this is brush knee and press. Again, block with the right hand, block with the left hand, and the right hand comes towards. Okay, so from the side profile, you can see it like this. And this and comes across about the height of the, at least again, the height of the chin. And comes up about the height of your ear. So actually, since I'm on my left side, you should see me from this here, this angle here. Okay. Now it doesn't have to come all the way back here. Some people, you may see people do Tai Chi say, oh, bring the hand all the way back here. Not needed for what we're doing for Sun style. And also the smaller compact movements will be more efficient for your health. So the height of your ear is plenty. And then again, you lead with the fingers, and at the end, there's press. Now, notice I'm not 90-degree with my wrist. Why? Because 90-degree the wrist can potentially overextend the joints. You don't need to do that. So lead with the fingers, and there's a gentle upturn of the palm, like you're reaching for a door handle. That's always a good way to explain it. Like you're reaching for a door handle. And relax. Again. Yeah, block, block, and comes up. Reach for the door handle. And it's like you're about to grab it. Relax the hands. Very important as you do this exercise. Help your clients know to feel the opening of the hand when you do this exercise. Okay. Good. Sibo?
So Mason has a good point. Brush knee and press, I see a lot of people do it like this. Again, as he said, that's bad for your wrists. Think about shaking hands. You come up like this and you shake, right? So the same thing here. The hand comes forward as you're going to shake someone's hand, and then I gently push forward from the wrist. Okay, so from the side, you can see it. The hand comes forward. Hand's actually facing me like I'm going to go shake someone's hand, and then as I finish, I rotate at the wrist joint here, push forward, push back. So that's brush, knee, and press. So this again, good for what? Elbow, wrists, and then again, body coordination. Next movement is needle beneath the C. This one's important for what? The lower back. And you look at statistics, 60 to 70% of Americans have lower back problems. And that's because they don't use their lower backs and they sit too much, okay? So this exercise designed to help stretch out the lower back, increase the strength of the lower back without putting stress on your body. Because the other way you can do it is go and do sit-ups, okay? But that would tear the patient's back, not very good for you. So this is needle beneath the C. You're gonna start with your left foot forward, okay? The right hand is gonna scoop down, and you don't have to go too far. Halfway down your thigh is fine. The hand comes up like you kind of lift something with your arm. You rotate this arm, and then you take a small step and push forward. So this is needle beneath the C. And then now reach forward. First move back, raising the toe if you notice. And then coming back, the toe touches the ground, and then I settle back down. The other side, same way. I step forward first, heel touching the ground, then the toe. As the toe touches, I lean forward. I raise. As I'm raising, I'm pushing from the back leg upward rotate, and now I take a small step and press forward. This hand is at about your forehead. And again, when I'm pushing forward, same thing, shake hands, okay? And then after you've done that, reach forward, again, raise the front toe first, step back, the toe touches, and then you settle down. The heel and toe helps to strengthen the ankles. And as you get older, most people tend to just kind of drag their heels along and their ankle is no longer lively. So this is very important for aging, that you make sure that the ankles remain lively in your foot. Okay, now I have Mason demonstrate.
All right, thank you, Sifu. So that's very, very important, folks. Again, you may be wondering what the purpose is for all these movements. I may not be trying to train the next martial artist or athlete, which is true. But as Sifu said, these movements are supposed to help energize your channels and get your clients work moving, which is important. Okay, so I'm gonna do it from the side because you saw Sifu from the front. I'm gonna do 3 on this side, going that way, 3 on the other side, going this way. Okay. So again, my left foot is in front. Again, my toe is down. My right hand's gonna scoop. Now, here's the thing, pretty important. I am not scooping like this. What's wrong here? My spine, you can see the characters on my back. They're out of shape. I'm bent and I'm hunched. You don't want that. Instead, take your hands, feel that. Remember when we did that exercise here? That's where you're bending. And that's the only place where you're bending. As Steve said, you're leaning forwards. It's because you're folding here. Watch, see my hands? I fold on a vertical axis on that line, like a clamshell. That is the strengthening of your back that you want your clients to work with. None of this roundedness. That's gonna eventually end up with a hunchback or worse. So that's what Steve was saying is very important. So you can see me from this angle. See the characters on my back are straight. If you took a ruler and strapped it to my back, that should still be straight as I go down. Oil up. Fan to the back. Okay. So I'm just going to do the same side on this side, and then I'll do the same side, the different side going this way. So again, and up. Go. Stand with both hands, draw back in, and down. Okay. I'm going to do the exact same side. Scoop. Unfold. So again, like the clamshell opens up here. Fan to the back. Stand. Draw back. Down. Last time on this side. And again, it's very important to make sure both sides of the body work. So that was my my left foot. Now I'm going to do my right foot this time. Now, if you're curious, well, what hand? Your opposite hand to the opposite foot. So right foot, left hand. Again, here, from the standing position. So my right toe is going to touch the ground. My left hand goes down. Same thing. See my back? I close the horizontal axis vertically here. It goes vertically along this line. Left hand scoops up, rotates. And then I extend. Again, like Steve said, leave the fingers, open the palms like again, like you're shaking someone's hand. Extend, go back, and down. All right, let's try again. So scoop down. As you unfurl, unfold from the hips, go forwards. And also important, same thing I said before, notice where my knee is, does not go past the vertical line of my toe. Come back and down. Last time. So this is needle beneath the seat. Fan to the back. And then again, just like always, draw in, down, and very good. Okay, Sifu.
Okay, again, how should I say, we have a limited time, so there's only a limited number of techniques we can use, but again, make use of these techniques, try them yourself. And like I said, there are very different degrees for doing different kinds of exercise. Most of them very gentle, very relaxed, easy to do. Next, we're going to do Fair Maiden works the shovels. So you're gonna start, in this case, with the right hand on top of the left, okay? You're gonna raise the right hand, push to the left, okay? As you come down, drop the hand here, raise and push. Okay, drop the left hand on top, raise the right hand, press up. Drop the right hand on top, raise, push to the left side, okay? So again, very simple. Again, as the hand comes down, you sink into the ground, bending your knees. As you come out, you straighten the knees, pushing forward. Then as you release, coming back, you bend your knees, you drop the top hand on top of the bottom hand. And then go to the other side again, push up from your knees, press forward. Again, bend the knees, dropping the hand down, pushing up, pushing out. So this is fair maiden work shoulders. Lisa?
Okay, there you go. All right. So from your standing position here, I'm going to bring my left hand here. This is my right hand. Go ahead and just gently place it on top here. So sink, bend the knee slightly. I turn with the waist, my hip's still here, but I turn my waist, I look 45-degree angle to the left corner of the room. Now I draw my hand in, settle back here. And now my left hand is on top. Now we can alternate sides. Bend the knees, turn with the waist. Now the right hand rotates up, left hand extends out. You may be wondering how far you should extend. This is about 70% of how much I extend. This is 100. You don't need 100. 70 is fine. You want that roundness here. Same thing with this arm. Okay, I'm not out of frame, a straightened arm. Rotate. It's a nice, gentle 70% roundness. Back. Now again, right hand's on top. So now you can do both sides. Again. Fair maiden versus shuttles. Left. Maiden versus shuttles right. Okay, one last time, then we'll move on. So to the left side. To the right. And that's again just from a standing John Jung position. Okay,
Next one, of course, is a classic part of all Tai Chi. Every style has their own version of it. This is the sun style version. This is wave hand like clouds. So main thing to remember, the hips do not move, because if they move, you'll be irritating the knees. So the waist has to turn, but your knees cannot. So you can't turn your knees like that I just did there, okay? The knees have to remain in place. And if you like, you kind of bow it out just slightly, so there's a real roundness to it. And then now turn the upper body. So a couple of things. Eyes follow the hand. Okay? So the eyes lead your movement. It also controls your yi, or your spirit. So in practicing this, you're also helping the patient go into the state of meditation. So of course, that's one of the important benefits of Tai Chi. This is one of the easiest way to work on meditation. Rather than just standing still, you're moving a little bit. So you get some exercise, but also you reach the same state of meditation that you normally get. All right, so I'm gonna have Mason take us through that. So it's wave hand like clouds.
Oh, I see real quick.
I did already. Oh, okay, yeah, I'm gonna take a break.
Okay. All right, so we're gonna continue again here. We will take a break in a minute just to allow for people to get a little water, to use the restroom if they need, but we'll go into wave hand like clouds now. So again, doesn't matter which side you're gonna start on. I will start with my right hand up just for reference. So wave hand like clouds. And again, I alternate. Now the left hand goes across. I am just again turning the waist, the hips and knees and feet stay forwards. But for those who want to understand how I'm moving, I am shifting from my left claw to my right in time with what hand's on top. So if my left hand's on top, I am going to the left side. My right hand's on top, I am now going to the right side. And that hand is a subtle roundness. sun style wave hand like clouds looks almost like it's going just horizontally, but it's not. And it's good for you and your clients to understand that roundness here, because again, you're using subtle, efficient movements, but to help you make sure you're not rigid when you're practicing or prescribing these movements, make sure there is a ever so slight roundness to that circle. Open up, and again, see my fingers, they also open up. Open up the fingers, close the fingers. Open up, fingers, and close. Let's go ahead and wrap that up. So 3 and 2 and 1. Good. And circle. Okay, circle.
Okay, so we'll be taking a break, but for the next part, you will need a Tai Chi ruler. Now, of course, you may not have a Tai Chi ruler. What I suggest you do is get a newspaper or a magazine, roll it up, put a couple rubber bands on it so you can use it. Also, any type of rolling pin or whatever kind of wood you might have that's rounded like this can be used for the next part. We're only going to introduce a few basic techniques, but how shall I say it? This is one of the techniques I inherited from my teacher that he wanted me to popularize and pass on. It's very good for helping the student understand what Tai Chi, Qigong, and Tai Chi practice is about. So I'll talk a little bit more about its benefits. So we'll be learning some basic techniques to get you started. And then we're going to finish up this program with all the techniques that Mason just showed you. I'm going to show you how to put it together in a form that you can teach to, like I said, patients who are in better physical condition and don't want to just do boring motions all the time, but combine them. I will show you how to combine. Okay, so we'll take a break now. We'll see you in about 5 minutes or so. Thank you.
All right. Thank you. Okay, so go ahead, take a 5-minute break. I will put on a timer just for those who are curious. So let me just do that real quick. 5-minute timer. All right, and what I'll do is I will share my screen and we'll just use that as a point of reference, okay?
So, okay, thank you.
Yep, thank you. So again, a wooden spoon also works. Something that's so yeah, welcome back everybody. Again, a wooden spoon will be is another option, but again, you can take some newspaper or a magazine, roll it up, and put a rubber band in the center or the ends to help you do this exercise. So, Sifu.
So if you haven't seen this before, this is called the Tai Chi bump. Now, historically, we believe it was developed by the Taoists. How long ago, we don't know. The earliest written recording of it actually is the Book of the Yellow Emperor. It talks about it, which is a very old text on Chinese medicine. It's also mentioned in the Song Dynasty that the emperor himself, Taizong, he loved this exercise and he promoted it. So we do know that. My version, however, doesn't come from that source. It comes from Chen Village. And I do not know historically how it arrived in Chen Village. And in fact, the history of this thing is so old, we actually, don't know who developed it and how it actually developed. But it's been passed down for generations and generations. So I was one of the inheritors of that technique. And I always tell students when I was learning it, Grandmaster Fong Chang would tell me, stand in the corner, but don't let anyone see you. It's a secret. Okay. And then when I saw him in 2000, he told me, oh, no, I want you to begin teaching it. So this is an introductory program on the use of the Tai Chi ruler. Why is the Tai Chi ruler important? First, it gives you something physical to feel. So the hard part about Tai Chi Chuan is if you cannot feel the energy, there's no reason to continue to practice it, right? You have to feel some tangible result. The ruler itself is meant to give you feedback so that your mind and your body begin to understand that the process of moving energy is going on. The ruler should be made out of something organic, so mine is made out of wood. In this case, this is a very expensive one, and also it's a very heavy wood. So it's preferable you don't use a light piece of wood, but a heavy one. This one, I think, is made from cocobolo, so it's very heavy. You can also get some mahogany. If you have friends in China, you can get one made out of tangmu. Okay, it's another kind of wood. Anything that's kind of heavy is quite good. So when you're practicing with this, you want to make sure that you contact the ruler with the edges, with the palm of your hand. You're pressing against it. So as you know, there's an acupuncture point in the middle of your hand. You're pressing against it to activate it. The other reason for being heavy is that when I do, for instance, pouring qi, this movement is called dou qi. This has some weight, so that as I come down, you feel the weight. It also encourages you up to empty your weight to this side because you feel the weight here. And then as you go to the other side, you feel it empty, and now you feel it fill on this side. So that helps you feel the shifting of your weight and the movement of your energy. So eventually you can feel the energy. That's important for the patient. If you cannot feel what you're doing, doesn't matter. So keep that in mind. What I'm going to introduce to you is ways in which to help the student identify, oh, that's Tai Chi. I can feel the energy moving. So try it yourself. I'm going to have Mason introduce you to the fine points of it, but this is called Dou Qi. So a couple of things. You don't lift it and drop it down. Okay, it comes up to the Tanzhong point, yeah, the heart point, and then you slowly let it empty. So you notice I didn't just go donk. Okay, I bring it up to the Tanzhong point, and now I slowly let it go down. And as it goes down, and I feel the weight, I concentrate all my weight here. This side is full, this side is empty. Same thing, I come up, so you take your time coming up. As you drop, shift your weight, okay? You can feel the energy and weight shifting as you practice this. Later on, we'll do the Qigong without the ruler. You should feel the same thing. All right, Mason, please.
All right, thank you. Again, for those who are trying to find a suitable tool to implement, they do sell Tai Chi rulers on Amazon. We are no way, of course, affiliated with this. We'd like to put a disclaimer that we're not endorsing any particular sellers, but you can find some options online to take a look at. You can also find alternatives, as Sifu said, like a rolling pin. I personally, with that being said, suggest if you're looking for some, you could go look up French rolling pin. They're the most basic looking rolling pin. They do not have a moving part in the center. So French rolling pin is an alternative. It's a little cheaper. Again, you can take a look and find what options work for you, and including, of course, as we said, a rolled up newspaper. Those can work, or wooden spoon. But for the time being, again, hold your ruler in your hands against the logam points of your hand, your palms, which again, right there. And just out of here, bring the ruler up. About the height of your, again, your belly button is just fine. And then drop. And you notice I am also shifting slightly to my right side. If they can't manage, if you or your clients can't manage that, a standing position is just fine. Okay, but I will, for the sake of this exercise, and for the most of them today, be shifting. Now bring up, just like Steve said, about the height of the heart or sternum, and then drop on the other side. Come up. And notice I am rotating my hands against that point there. As it turns and I shift. And what I'm feeling is I feel the weight of this object, because the ruler has an objective weight to it, no matter how light it is. There is mass that's involved. It gives you a counterbalance, something that is actually there. So you can feel the change of the weight in your palms. That's what makes the ruler so useful. And for you, practicing for health or therapeutic Tai Chi, it gives you an idea of what you actually should be feeling when you're doing your Tai Chi practice. So let's do 3 more. So 3 and 2. And if you're curious again, you may notice I'm not going faster than my breath goes. And one last time on both sides. 4. Take the time to appreciate the weight. And breathe. Good. Now, notice here I'm going to just breathe in and go down. And that's how you can do it. So go with the ruler. More on that later, though.
Okay, I'm gonna have Mason stay here for a moment.
Sure.
So that is for most patients.
Mhm.
Someone again with higher physical ability, Mason's gonna show you how to do it by lifting one leg. Okay, this is, remember, much harder. Okay, so again, it depends on your patient. This is for someone with more athletic ability who has some problems, but is not, how should I say, doesn't have problems with balance. But they can start with a basic, and then this is the more advanced version.
So come in. As the ruler comes down, I'm lifting from my core. Come up. And I'm shifting over to my left side. And I lift with the core. Up. So as the ruler goes down, my leg, I'm not lifting from the muscles of my leg. My core is going to compress. The leg comes up. Now, again, this might be hard for even some people who may have just be physically fit. This, however, is still a way that you can do the pouring qigong if you're working with someone who's maybe wanting to do some strengthening exercises or work on their balance. This is pretty high level. Do not underestimate it. Know when to prescribe or when to use it. The one thing I'll add on there is to make sure your back is straight. Notice my spine is here. I'm not leaning from side to side. This takes a pretty good minute control of your abdominal muscles and your hip flexors as well as your glutes. So this one's a pretty complex exercise. Okay. So
The one final thought, you can also do a simplified version for someone who has some strength, but has problems with balance. So what I can do is, you notice as I turn, I raise my heel up. So my heel is not on the ground as I'm doing this. And then as I shift, I raise the other heel up. Okay. So that is a simpler way to do it. And then as you get better, then you try and raise the leg all the way up. Okay, so again, you prescribe that depending on the patient, how you would do it. Okay, there are also some exercises for cultivating qi. So this one is for, again, the abdominal region. So remember, your core needs strengthening. That's what gives you power. And so if the core is weak, the rest of your body will also be weak. So this one teaches you to what? Move the dantian area. So we have several ways. The first one is called ro qiu gong. It's called rolling the ball. So now you can roll the ball this way. You notice nothing is moving, just my hands. But what I want you to do is actually rotate the whole body. Now, as you're rotating the whole body, remember, again, your knees don't turn, the waist turns. You try and keep also the center of the ruler in one place as you turn. But you notice my shoulders and waist are turning. Okay, so that's forward and that's backward. Okay, so I have Mason take you through that. This is ro qiu gong.
okay, so standing again for your jaw position. Bring the ruler about the height of your dantian point, the belly button. I rotate again using my waist, but not the hips. Hips are staying forwards. But as I rotate the ruler on the right side, I am turning the waist with the ruler. This is ro qiu gong, rolling the ball. So there's forwards, we'll do forwards 3 times. So 3 and 2 and 1. And now let's reverse. Back Now reverse again, I am also still turning the waist. Knees and hips stay forwards. This should seem very similar to that same exercise we did earlier, where we rotated just from the Dantian point. In fact, you could say they're correlated. So you might feel again like you're making a yin yang symbol with your the belly button, or you might feel like again you're making a small vertical circle this time from the inside of your waist, whichever helps you visualize. So 3 and 2 and 1. Good. In and out. Okay, stable.
So next exercise is called tui bump. Tui meaning to push. However, it's important that you could tui just this way, okay? But when I tui, my knees bend, chest hollows, back rounds. Push into the ground, the body straightens back up. So you're gently exercising the entire body, also practicing the strengthening and lifting of the back. And so it's important in Tai Chi as well as for life that your back of your head and your spine be on a straight line. And so this helps to strengthen both the back muscles and the spine itself. So the simplest one, as I showed you, is just going forward, okay? Bending your knees. You bend it however much is necessary. If you cannot do that, okay, patient cannot do that, you don't have them bend their knees, but you have them think about, I'm pushing into the ground as my ruler goes out, and now my body straightens. I still round the upper body, I leave out the bottom, but the bottom I'm still thinking, I'm pushing into the ground. Okay, so you're doing the same thing as you're doing. Mason will show you 3 other ways, one going up, one going down. So this is tui bump, pushing the ruler.
All right, thank you, Signal.
Mhm.
All right, so we're going to start from just the one that he started with, which is the middle region. Okay, so it might help you to see me from the side, so I'll turn this way. So bring up the ruler about the height of your Dantian point or stomach. Bend the knees. As I push forwards, I'm also feeling my Ming Mun point behind me. So as the ruler goes this way, I feel an intrinsic energy that's opposite going behind me. Come back in. So this is Tui Bung, or pushing the ruler. So you notice I strain the knees slightly, bend the knees slightly. Okay, that's in the middle region. Drop the ruler down a little bit so you got the height of your bladder or the lower intestines. Now, as I bend the knees, I'm going to extend down, pushing down now. And same thing, notice the straightness of my back. I'm not rounded this. So same thing like we showed you with what? Need to see bend to the back. Come back up. Don't go faster than your breath. So whether you're breathing in or breathing out, breathe naturally. You can time your movements with the breath if it helps you measure how fast you should go. How slowly you should go. Stand. Come back. Stand. Back. Okay, one more time. Now, as Steve said, the third one is the upper region. So we did middle, lower, now upper. Bring the ruler to the height of your Tanzhong point or your heart. I extend. Bend my knees slightly. And I straighten as I come back in. Extend. And the ruler is going to go back like the height of my forehead or the third eye. And you can, of course, aim the heights appropriate for what's your client's own physical history is. Does not have to be very high. If you're only able to go about maybe the height of your chin, great. They can do that. That's awesome. But for me, I'm going to be aiming for the height of my third eye point. There we go. In. So that's 3, 2, One last one. And still going with the ruler, right? Very good. Let's go.
Okay, the next one is called Wu Xing Gong. It's for circulating the qi through the internal organs. So this one, you start at the level of the belly button and circle up and down. So now you can just stand here and just circle, or I'm pushing into my right leg and now my left. So I exaggerate a little bit so you can see my body actually shifting its weight. Okay. And then the opposite way is also the same. Okay. So now that's one direction we can do it in. That is called Wu Xing Gong. We also have Mo Pan Gong, which is in the, that first one was in vertical. This is horizontal. So it's in front of you. And again, you may just stand here and just circle, or as I show here, I shift my weight right, shift my weight left, right, left. So that is called Mo Pan Gong. Mo Pan Gong is most important. It deals with your belt meridian, energizes your kidneys, affects your Wei Qi. So it's good for the immune system and the general health of your body. The technique is based on the Taoist concept of convergence, meaning that the movement outside influences the movement inside. So while I'm making a circle here, I'm also making a circle around my waist, activating the belt meridian. And when I'm doing this, I'm activating each of your 10 organs as the hand, as the movement of the ruler is going on. Okay, so here, let Mason take you through those two.
Okay, very good. So we'll do horizontal. Sorry, we'll do the vertical and then we'll do horizontal. Okay, and both directions on either side. So doesn't matter which one you start with. I will be starting going to the right if you're curious. All right, so just relax, downward position. The ruler comes up about the height of your sternum. I am shifting my weight from the right to the left with the ruler. And again, time it with your breath if it helps you to know how slow you should go and how fast you should have, how you should make sure you're not going too fast. Okay. Around and around. Okay, so last time. Now let's try going from the right to the left. Also, there is a bit of a gap in front of me. I'm not have my ruler right against me. I have my hands just relaxed in front of me. Out. Okay. Okay, let's do one more time. Good. So again, multiples of 3. 3 sets could be plenty. You can work with what is appropriate. Now let's do one palm going forwards, out, and back in. So this is along the horizontal axis. So one palm going, circle. If you want to know how my breath is going, again, breathe normally, but I can breathe in here. And I breathe out as I come in. So if you want to slow it down, that could be a good measurement about how generally how fast you're going. So one more time. Good. Now I'm going the other way. So again, I'm shifting from my right quad to my left. And if the breath is too hard to coordinate, just breathe normally and have a ballpark figure of knowing how fast you should go. That's plenty fine. Especially those who might have be short of breath. That is an important tidbit to remember. Okay, so breathe in. Still going. Good. All right, very good. Steve, back to you.
So a couple of things that Mason mentioned are important. The concentration of the, oh, we have a visitor here. Yeah, the concentration of the patient. You have the patient concentrate on the middle of the ruler as they're practicing, using their peripheral vision, of course, not staring at it. Okay, so that they are aware of the position of the center of the ruler at all times. So that's number one. And then you coordinate the movement with your breath. Okay. This all helps you achieve the state of Mushin. Mushin is a state of quiet alertness, meaning your mind is in the state of relaxation, but you're at the same time alert of your entire surrounding. You may close your eyes halfway, but not all the way. Okay, so that's the requirements for Mushin. And so as you practice this, this is a way to reach a meditative state without just standing there and trying to empty your mind. The Taoists found this method to be more effective because when you have something to concentrate on, your mind cannot think about anything else. So, so you may find this strange. When I was actually learning from one of my teachers, he would turn the TV on as we're doing our Qigong. He says, watch TV. And later on, I asked him, why are you doing that? He goes, because as you concentrate and focus, eventually that disappears and you become aware of everything else. So that's kind of an important state to try and achieve. And so the ruler helps you to feel the movement of your energy, coordinate the ruler. It coordinates what? Different parts of your body, and finally coordinates your mind to reach a meditative state. Okay, so we'll move on now to another technique that is also important. These techniques, okay, so the earlier techniques we just did now are for cultivating your qi. The next ones are for moving your qi. These are kind of simple. This is nong bang, rocking your qi. So here I shift my way, goes one way, shift it goes the other way. Okay. I can also do it small. I can also do it big. Okay. And I can also do it forward. Okay. Now, just explain once how to change. As you come forward, my hand comes to the end. I run the ruler back. I bring it over my head as I switch legs. As I come forward, I push the ruler back up, and then I do it on the other side. So one more time, I bring it back, switch, bring it back, and then come forward. So this one is striking the gong. The other one is rocking the ruler. All right, let me have Mason take you through that.
Thank you, Zico. Okay, so we're gonna try rocking the ruler first, and then we'll do striking the bell, or striking the gong. So from your standing jaw position, again, hold the ruler, and I'm gonna shift to the right, shift to the left. Very simple. Again, take a moment to appreciate the subtleties of the shifting. The ruler is gonna go from right to left. And again, I'm not leaning, so I'm not bending out of alignment. My spine is still perpendicular to the ground. Okay, so let's try it. 3, 2, and 1. And let's try it a little bigger. So bigger, you can do different stance work for this. I'm just going to do the standing position. You might find some people who advocate doing a wider stance. I'm not going to do that here today. But I'm not saying it's wrong. I'm just saying that for most of your clients, this is plenty. So I'm up just like Sifu did. But this time, the ruler is coming to the height of your heart. Doesn't need to be that much higher from that. And what I mean by the height of the heart is like the center. Tanzhong. That's plenty. You don't need to go really high. Shift. And here, instead of just letting the momentum of the ruler drop, take a moment, hold this here with the bottom of this hand, and then relax. Hold it now with the bottom of this hand. Relax. Again, your breath is a good ballpark measurement. So 3, 2, 1. Good. Now let's do striking the gong. same as before. We talked about this earlier, your bow stance. So I'm gonna do it from the side so you can see me from the side, since you saw Sibo from the front. I'm gonna hold the ruler, make a fist with the right hand. Left hand's gonna just gently hold it forwards and shift. Again, 60-40% weight. So I'm 60% here now in the front, 60 in the back. Same thing. Breath is a good ballpark measure of how fast you will go. Okay. Forwards, back. Forwards, back. Forwards, back. Just count down. 3, 2, 1. So if you want to see the transition, we're just going to come back up, alternate my leg, now on the left side. For the sake of the camera, I'm going to shift over so you can see me from this side now. Okay. If you're curious how that transition went again, I'm going to show you one more time from this angle. So, ruler came up, change the legs, ruler now on my left side. Just gently hold this. Right hand's underneath it. Reason why I don't want to throw the ruler. So rock forwards and back. Forwards, back. So 60-40. And let's count down. 3, 2, 1. Good. Breathe in and out. Still going. Good. All right, so go on view.
So a couple of things to remember when you're striking the gong. Try and keep the ruler as parallel to the ground as you can. So you notice as I'm rocking, the ruler remains parallel to the ground. Try not to raise it up and let it fall, because that's not what you're doing. So watch again, it goes forward and back, right in the straight line. Okay, so that's kind of important. And when you change, it's the same way. It remains parallel to the ground. So that's important. So this is to help your body feel the movement of your chi. So these exercises are to help the patient feel the movement of chi. And again, I said that's most important. If you cannot feel the chi, you don't know whether you're doing anything or not. Okay, so that's really important. The next movement, we did wave hand like clouds. This technique uses wave hand like clouds because it's a Chen style version, not a Sun style version. So you start with your ruler on the right side with the right hand on top. It crosses the body. As you reach the other side, turn it over, bring it back. Now, how do I do that? I sink into the ground. As I sink, it turns over and I bring it across using my waist to move it, not my hands. So I don't want to do this and use my hands to flip it. I sink, it turns over. I go across to the other side, and again, I sink and it turns over. So this is waving hand like clouds using the ruler technique. Again, this helps you with shifting the body with your balance and also trying to feel the flow of the chi. Okay, let me have Mason take you through that.
All right, very good. So wave hand like clouds using the ruler. Right hand's on top, it's the left hand's under. Shift. Turn, I sink, like Siba said. Turn the waist. So same thing. Breath is a good ballpark measurement of your speed. So again, sink. Bring the ruler across. Sink on the right side. Bring the ruler across. Now sink on the left side. Bring it across. Again, wave hand like clouds, arguably one of the most important Tai Chi movements. I love this one a lot myself personally. Again, you're shifting from one claw to the other if you can manage that. You are using the whole body. All the channels are involved in the movement. And again, you're feeling the weight of the ruler in the exchange of your palms. Gives you a counterbalance or something that can actually give you physical feedback when you're training your Tai Chi. So let's try again, count down 3. And 2. And last set. 1. Good, and still going. Okay, single.
So again, because time is short, we will of course not show every technique. There are actually quite a few. The next one, however, is deal with what we call the big circulation, the chi moving through the stomach, spleen, large intestine, and the heart meridians. So this one requires you to bend. So it depends again on your patient, how much they can bend. If they can't bend very much, you just go down part way. I will do it kind of a little bit harder, kind of to show you the path, but it traces the way the legs, how the chi moves through the leg. So you start with the ruler on the outside, you go down the outside seam of the body, turn the ruler to the inside in the same way, draw the chi up to the dantian area of this leg. Okay, so that was the inside. Now you go to the outside, go down the outside, go around the leg, come up the inside, up to the dantian and go down. So now, if they're old, they may not be able to do that easily. So they can just simulate the movement by bending down slightly. I'm going to have Mason take you through it the more difficult way. So it's better for you, of course, because it improves your leg strength, it improves your circulation, and it will help you also strengthen the lower back at the same time. All right, Mason, please.
All right, here we go soon.
Wow, thank you.
So down the outside, in the outside.
Yep, and then down the outside, up the inside.
All right. So I'm gonna go down the right side. It doesn't matter which one you start with, as long as you do both sides. So down. Bring the ruler up the inside. Come up to the height of your dantian and down. And the ruler around and up. So again, good if you want to work with your patient to get their training for their full body movements. Go slowly. Again, remember, don't round and hunch the back. You're folding at the your waist. Down. Rotate. Come up. Down the outside again. Up the inside. Let's do one more. Down. Up. Down. And up. Good. So legs can be kind of tricky, but something you also can train, and hopefully using the ruler for this can help you visualize and your clients visualize when you're working with them. Okay. Sibo?
So the bending of the knees is actually an important feature. When I first learned it, we did not do it that way. Later on, as my teacher grew older, he realized the importance of that. This technique or principle is borrowed actually from Qigong practice. We call it using your heart as your legs as your second heart, because you're bending and expanding and contracting your leg muscles. It pumps the liquids and the blood from your feet back to your heart. One of my students, Dr. Lawrence Lee, he's a PT professional he graduated from UOP. He wrote his thesis on that, meaning that through the process of Taiji, you increase the pumping force of the heart. It can actually be measured. So using the legs are quite important. So make sure you understand that feature, regardless of what we do. Even if it's very small, I'm still what? Using my leg. I'm still bending. I'm still pressing into the ground, okay, to get my energy to move. So that's really important. Now, the next one I call pounding mochi. So I call it pounding mochi because it looks like that's what you're doing, okay? But the importance, again, I'm using my legs. I'm also using the whole body as I practice in coordination with the ruler. So how do you do this? You hold the ruler with both hands, okay? This is your mochi pounding stick. The mochi barrel is here, the mochi is inside. So you bend your knees to raise the ruler up probably to about Tanzhong point. And then now you straighten, pound, go up and pound. Okay, so now this is one variation. Another way to do this is you bend, and now I push the ruler forward and then sink. Push forward and sink. All right, so I have Mason demonstrate to you that mochi pounding, and this one is called tree sticking out of the forest. All right.
Thank you, Sue. Okay, so again, we're gonna start with the pounding the mochi. it's a cute name, but if again it helps you stick, that'll be good. So ruler about again the height of my tonjong, bend the knees, ruler comes down, and the knees, ruler comes up, and then you straighten, ruler comes down. So again, just lower, keep the spine straight, and let the weight of the ruler go down, and you gently hold it. Again, like a pistol in mortar. So if you're like grinding up like seeds for wheat or grain. But yeah. So 3, 2, and 1. And let's do again. So extending, pushing the ruler out forwards in front of you here. So ruler's going to come in. So similar, you just straighten out as you bend the knees, ruler comes up, and then straighten again as you extend. And bend the knees. And push the ruler out as you straighten. Side profile. In, down. In, out. Let's do 3 together. So 3 and 2 and 1 last one. Good.
So we're gonna finish with the last one. This is called Sandan Chai Qi, means circulating the qi through each of the 3 dantian. So lower dantian, middle dantian, upper dantian. So this is for, again, cultivating your energy. It's also a very simple, easy to do exercise that can help any patient, okay? Again, the purpose of the exercise, develop coordination, develop flexibility, range of motion, also strengthen the body as you practice it. So how are we strengthening the body? By bending it gently and pushing up, you're playing with the most basic weight in the universe, your own weight. So by strengthening, by bending and straightening, you're actually exercising using your whole body weight. And that will be a gentle, easy way to strengthen your body without hurting yourself. Don't have to lift any weights. You lift your own body. Okay, so the next one is Sandan Chai Qi. It's 3 dantians. So you're going to be going forward. So first, that's lower dantian, middle dantian, upper dantian, which includes the middle eye and Bai Hui at top, and then you come back down. Back to the dantian, lower dantian position. So 1, middle dantian 2, third dantian 4. Repeats again. Again, this is a very simple, easy to do exercise. The eyes of the student or patient should be focused on the middle of the ruler. Again, trying to help achieve that meditative state. That meditative state, by the way, we call Mu Xin. Mu Xin meaning what? The mind is empty, but the mind is alert. So this is different from meditation achieved through Qigong or just standing there. That type of meditation achieves the second level of meditation we call Rujing, meaning the mind is quiet. But Mu Xin is a martial art level of meditation the mind is relaxed, but is also aware of everything you do. So let me let Mason take you through that.
This also touches upon the three different bowls, the three different dantians. You have your lower, your middle, and the upper. So I'd like to add that there. So you're seeing Sifu from the front. You're gonna see me from the side. So circle the lower dantian, the middle, and the upper. And then come down. Again. Lower. Middle. And upper. Last time. The lower dantian. The middle dantian. And the upper. You encompass all three. And if you like to end it, you can go come up and circle once. And that's a good way to frame that exercise there. So good. All right, Sifu.
So the last sets of exercise is for what you do when you end the ruler practice. So this is Jingji Doling, you shake. This is kind of easy to do. So this is the rebalance your chi, also the move the stagnation from your feet out of your feet around your body. So your feet don't hurt so much from standing, okay? So that's important. So that's number one, shaking. Number two, this is for your wrists. You just relax and rotate. Okay, very easy to do. You can also rotate this way. Okay, you can also rotate this way and rotate in reverse. So again, rotate one way, rotate back. Okay, I'll have Mason demonstrate those. These are again the final part of your practice as you end it.
Okay, thank you, Sifu. All right, so just have your ruler here. We're gonna shake it out. If you're curious again how much you do, target like a multi and a multiple 3. I'm gonna do about 12. So if you're curious about that again, I'm gonna do that one more time just so you can see. And that's again just helping settle, get everything reset. And then again, or like Steve said, to help doing some wrist exercises for the ruler. These can be a little bit difficult, but if you want to follow along, again, I'm going to first circle. Okay. So you might have some difficulties of range of movement, but relax the ruler. Okay. So again, I'm spinning the ruler, and I can try the other way. Okay. Try the other hand. Again, relax, point the ruler in. Try the other way. And then that was a vertical. Let's try horizontal. So holding the ruler like a horizontal, like a platter. But again, my middle finger, my thumb, and my pointer finger are helping stabilize the ruler. Rotate around. It may help to think about one end of the ruler, making a big circle. Horizontal, one way, and then horizontal the other way. Okay. Try the other side. So circle. We've done about 9 one way. I'm not going to go 9 the other way. Again, you determine what's appropriate. Okay, good. So those are some exercises you can do again at the end, just for working with the ruler.
Okay, so at this point, I'm gonna take another 5-minute break and I'll come back for the last segment. Last segment, we will go back and talk about how to arrange a routine that a student or patient can practice that is easy to do, easy to remember, but also effective and how should I say? They can feel good about doing it, okay? And so some students may be, or patients maybe in better shape, better health conditions, may find this performance, or not performance, but these techniques, when they're connected, to be quite useful for their daily practice. So we'll come back for that. That'll be the last segment, and then we want to thank you again for attending. And of course, we'll be open to questions. So let's take a 5-minute break now. We will be right back.
Yep. Thank you, everybody. So I'll go ahead and put the timer on. Go ahead, get some water, shake out your legs, walk around for a second. I will share my screen and bring up the timer again. This is good. Yep. We're going to be wrapping up our last session here. Again, so with that being said, Stephen, back to you.
Okay, so I should mention a couple of things. What we have been practicing is Tai Chi Gong, okay, or Tai Chi Qi Gong, meaning that these are exercises of both meditation as well as coordination and breathing, and for developing the body's energy. Okay, so these are Tai Chi Gong exercises. But Tai Chi Chuan also has what we call Tai Chi Chuan. The Chuan is what? Is the form. Okay. The form originally, as I said, is used for combat, but for health, that's not that important. So I know I've talked to many acupuncturists and TCM doctors. They all tell me, oh yeah, we study Yang 24 or 32 sword. Keep in mind, those techniques are for competition. They're not for health. Health and medical Tai Chi is a completely different animal. The reason we have picked Sun Tai Chi, as I said, is because one, the CDC recognizes, and that there is data to show that it can actually help people who have arthritis, who are trying to prevent arthritis, or already have pain. It is something they still can do. And the reason is because Sun style Tai Chi is done standing up. It is the only style of Tai Chi that does that. If you look at the other styles, they're beginning to evolve in the direction, but they did not go all the way. Sun lived until the 1930s. He had a chance to see the old styles of Tai Chi and evolve it based on the principles of Tai Chi. Okay, what principles? For instance, open and close. Okay, so all of his movements have that, but also liveliness, because it's standing up. He wanted the student to be, or patient to be what? Nimble and able to move. So even at an advanced age, and you can be in your 80s and 90s, you still could practice this. Madam Sun, his daughter, practiced it way up into her 90s. So you can see this is a style of Tai Chi you can do. Most of the other styles of Tai Chi, you cannot practice it. Actually, as you're getting into your 70s and 80s, it's too difficult, too hard on your knees. Many postures you can no longer do. So that's not appropriate for, again, medical Tai Chi. So I'm going to introduce to you, based on the movements that we practiced today, a simple form, okay? So I'm going to go through some of the first movements. Now, the first movement, beginning Tai Chi, I already showed you 3 different methods. I'm going to use the second one, but you can use either the first one or the third method. And if you need to, later on, you can go back and look at the YouTube video and see what the 3 different methods for beginning Tai Chi were. Okay, so start with your feet. Your feet are slightly turned out like this in a V. Okay, so they're not straight ahead, it's in a V. Okay, this allows you to be, because your foot is at a bigger angle, allow you to balance yourself more easily. So first, sink your weight into one side. Okay, lift the heel of the left foot. Left foot goes out, shift your weight. Okay, slowly. And now the second method of doing beginning Tai Chi. Again, you're going to rotate your palms and I sink. Raise it up to your forehead. From your forehead, reach forward. Imagine you can reach to Beijing or to Taiwan, as your case may be. Bring the chi to the Pangguang point. Pangguang is your temple point. It comes to the temple point. Turn the palms up, press down. This is called Sha Ta Jia. Pushing down and then separate. So that's beginning Tai Chi. Move number 2. So we're going to do it on the right side first. You circle. Okay, so we did this early, but now this time I shift my weight to the left leg. I'm gonna step forward with a right leg and then extend. As I draw back, I move my back foot back, the toe touches first. I roll back to my heel, raise the front toe, bring it back to Jianzhong. And now the other side, same way, I circle. Again, I touch. Step forward, heel first, heel the toe, push forward, extend, return. Okay, now I'm gonna use my right hand first. Just bring it around in a circle, inserting my hand. And now all I'm gonna do is separate. Then turn back to the other side, insert the hand. And I'll separate the two hands apart. This is Yema Fenzhong. The wild horse parts its mane, okay? So those are the first three movements. So I'll have Mason take you through those.
So from the beginning, relax, step out. And just a simplified opening. So again, turn, up, relax, extend. Bring the hand in and down. Relax the hands. So this is right and left press. So the right hand can come up. Left hand goes under, open up. Touch the wrist. All my weight's on my left foot, so I can step forward to the right foot. Press. Separate the hands, reach forwards, step back with the foot, put the heel down. It should be very simple stepping. And the left hand comes up, just like we did before. So these are the same movements. My weight's on my right foot. Step, heel, toe, then shift into that leg. And press. Separate, draw, down. Now, part the wild horse's mane. Insert the sleeve, and then open up from the waist. My right hand, I'm just going to insert under, the left hand's on top. Then open. So it's some version of doing part the horse's mane. Good. That's that section. Back to you, Sibo.
So again, these movements are derived from the Gong practice that we did earlier. So again, I'm going to start from the beginning. So shift your weight all the way to the right, empty the left. Step out with your left. As you sink, rotate the palms and raise. Comes up to about the height of your forehead, the pangguang. Then relax. Feel the bottom of the ball. Oh, I'm sorry.
Yeah.
No.
Unless we want to do that one.
Yeah, we won't do that one. You can do that one. Okay, sorry. But you come up, so we're trying to keep it simple. Reach out and then draw the chi back. So that's the simplest one. Okay, because you can even do the simpler one. You can also do the first one. So then circle, touch your wrists, empty to the left, step forward with the right. Extend. Imagine reaching way out there. Step back, draw all the chi back, raise your toe, come back, relax. So now left side, same thing. Rotate, touch, step forward, press. So dissolve, step back, push down. So this is on energy, pushing down energy. Then this is opening and closing. I close here and now I open. So open the chest. And then now as you come back, close the chest. And then again, open. Now draw the hand in. Next movement is, okay, and relax. This is turn the arms over. And then brush knee and press, which we did earlier. 2. Push forward. Remember, you're shaking your hand. And then 1, 2, bring the hand back. Again, like you're shaking the hand. Push forward, also push backward. All right, so let me have Mason take you through those set of movements.
All right, so again, so just doing the new ones we just added on there. Again, we're going to be doing after we did the horse's mane is a repulse the rotate arm. Some people will call it repulse monkey. Just not getting too much into it. That's a misnomer, but more on that later if you're curious. So you can have your right hand forwards, left hand by your ear. So again, the left hand goes out, right hand comes in. So rotate 1, 2, 3. Kind of like how we did earlier when we did the joint loosening. Right hand's up by the ear, and then go out. Now again, rotate 3 times. 1, 2. When you're about to do the third one, the left hand comes up. You finish rotating, the hand goes out again. So 1, 2, 3. Now, relax the hand. This is like we did the other movement before. Brush knee, brush knee and press. So again, relax. Left hand, right hand. Okay. So putting that all again together with the next movements. Signal. And
Okay, so we were at brush knee and press. Actually, I forgot. I didn't include any stepping, so let me do that right now. So again, we'll go back to the last movement, which is parted here. You come back here. For this set of movements, you don't move your feet, okay? Your feet are not moving. So this is done 3 times, rolling the arms. Okay, now 1, 2, but here you shift your weight all to the right foot, you step forward. Now the step back, we add an additional move. This is playing the peepaw. Step back, thrust the hand forward. Okay, and play the peepaw. And now step back. And now you do the other side. 1, 2, again empty, step forward. As you step back, play the peepaw. And then return. Okay. Next movement, the left leg is going to come forward. This is needle beneath the sea. Fan through the back. Okay, we practiced that earlier. Again, that's on the video. You can check it later. Okay, again, scoop up, take a half a step forward, press forward, come back. Okay, from here, Mo Pan Gong. Bring the hand in, press to the corner. Relax, go back, press to the other corner. All right, let me have Mason take you through that.
good. Let's try it up to that point. So I'll take us from the beginning. So relax, step out, turn up, stand, and this is just the simplified starting. Relax. This is right and left press first. For the hands and down. Left side.
Step forward.
Oh, sure. Okay. Now, part the horse's mane. Pause. Good. Now rotating the arms. Right hand's in front, left hand comes to the right ear. Push forwards. Rotate 3 times. 1, 2, 3. Push. 1, 2, 3. 1, 2, 3. Good. Next ones we're gonna, of course, do now is gonna be right and left block and going into your brush knee press. So relax the hand, block 1, 2, and here again, you can take a step. So empty out the left foot, heel, toe, step forwards, follow step with the right foot. And then as you step back, your left hand go forwards. From the side, it looks like this. This is play the peapod or play the lute. Okay. Back and down. Now block with the right hand. Yeah, block with the left hand, block with the right. Left hand comes by your ear. Step with the right foot, heel, toe, brush knee, press. Now the right hand's going to stand out, play the peep on this side. Good. Down, needle beneath the C, fan to the back. So just like before. Down, up. Just like we showed before. And down. And remember to fold from the horizontal line of your waist. Okay. Good. And then more power going. 1, 2. Right hand's gonna come up. Left hand's by your elbow here. Step to the corner. Remain works the shuttles. Okay. Back. To back to standing position as you do ball pong on once, twice, stay where you are. Now left hand comes up, right hand's by the elbow. Step to your left corner. Very many works of shuttles. Send the hands and down. Good.
Okay, so next, we're gonna add wave hand like clouds. And one other move that I did not show you, but we will work that all in. Okay, so again, start from the beginning, Janjong position. Relax, sink into the right leg, lift the left, stepping out. Again, relax, lift. Okay, then reach. So reach as far as you can, sending your intention out. Draw the energy in, sink it to the bottom of your feet. Right side, shift your weight to the left, empty the right leg steps forward.
Mhm.
Step back, toe first, then the heel. Okay, relax. And now the other side. Notice I relax completely before I start each movement. So I come back to here. I relax completely. Yeah? Then I shift my weight to the left and now to the right and then separate. So this is closed, chest is hollow. Now I open the chest. Turn back to the other side. Do not overturn when you do this. It stops right on line with your shoulder, okay? The right hand comes in, so you just bring it in, shift your weight to the left, and now rolling the arms. On the third one, lift both hands, bring it forward again, and then again, rolling the arms. On the third one again, lift the arm, bring the hand forward. So for this, you haven't moved anywhere. Now, brush knee and press is next. 1, 2. This time you empty the left foot, the right foot has all the weight. You step forward, brush knee and press. Okay. Bring the hand to your waist, step back, playing the peapaw. So in this position, my toe is touching the ground in front. Okay. And now step back. Okay. And then 1, 2. Now on the other side. Again, make sure this hand pushes backward as this one comes forward. Step back and return. Next is needle beneath the C. Okay? Fan through the back. Again, shift back slowly, then bring your foot back. Okay, again. Scoop up, step forward, come back. So now more upon going. Right side, relax. To the left side. And now from here, wave hand like clouds. 1, 2, 3. Okay. And then from here, you're going to turn to your left side. Okay, so the hand is here. Step back. We didn't show you how to do this. Tucking the robe. Push forward. Okay. Turn back. Bring the hand back. Oh, wait, no, sorry. Bring the hand forward. You go right into tucking the robe. Then from here, separate. Come together. Ending Tai Chi. So a very simple set of Tai Chi movements that anyone can do. Okay, let me have Mason take you through that.
So for those who may have been with us on a previous session for therapeutic Tai Chi, we did cover tucking the robe before. So that one, again, I'm just going to isolate specifically that one so you can see it one more time. So from here, when you're in your standing position, we're going to go to the left side. Right hand's going to touch the top of the left wrist. It goes out, comes in. Goes out, I press the back of the hand. Come in, and I step, fall step as I push. Relax the hand. When my left hand comes across, it's going to touch the right wrist, so like we just did. Now this time, the right hand's down, left hand's on top of the wrist. Circle in front of you, kind of like doing Mo Pang Gong. But this is actually Pong. This is Lu, or expand and roll back. This is a press. This is on. So sink, push. And then again, how you end it, open up. That's just singling out that last movement. So doing it with the other movement we just did, which is wave hand like clouds. I'll start from there. Okay, and then we'll hand it back to Sifu. So wave hand like clouds. 1, 2, 3, 4. Good. Now turn. Tucking the rope. Push. So it's almost like you're sweeping across with the left hand. Now you can do tucking the rope on this side. Pong, Lu, G. And as you step. Open up. All right, Sifu. So those are the last 2 movements we just did.
So I hope that was interesting. Now, not every patient can do all that, especially if they tend to be seniors. If you're in a senior center, for instance, teaching, you may find that the students even have a hard time with that. This form may be adjusted in different ways. So I'm going to adjust it in the real simplest way possible. So I'm just going to show you one possible variation. So you can keep it very simple. So just like this. Oh, wait, I should step out first. Okay, so beginning Tai Chi using the very simple beginning. Reach, draw back, sit down. And so now turn. Press. You notice I didn't move anywhere. I'm just standing here. Okay. So now, if that's all they can manage, you just come back to here and close. So that is even simpler. There is no movement. Now, if you have a patient who can move a little bit, you can introduce some movement using the same movements that we just did. So now this is a little more complicated. I'm going to use the third way of doing beginning Tai Chi this time. So again, you lift up, roll down, feel the ball, roll it back, push it forward, roll it back, push it down. So now I start the same way, but this time I'm going to move. So this is for a patient who has a little more mobility. Okay, step back. Step forward. Step back. And now. Separate. Separate. And you can bring it in without any turning of the palms. Also, and again, you can end it right here if you wish. So you can take this form and cut it down however is appropriate for the patient or clients that you are working with. So this is meant to be usable in any senior center or senior facility. We designed it that way so that anyone can adapt it for its use. And of course, I'm open here to answering any questions you may have about that. But basically, that brings us to the end of today's session pretty much. And thank you for attending. I hope that I gave you some tools you can use. If you have questions about the tools or how to change or adapt anything, I will be here to answer any questions. So again, thank you very much. Mason and I appreciate your attendance. Please have a nice day. Thank you.
All right, thank you very much, everybody. Again, thank you for your flexibility and adjustments to our schedule today. That will conclude the sessions for today. Again, if you are curious or have questions, let us know over the last amount of time that we have here. Again, for just a reminder, as Christy mentioned earlier, if you are looking for the certificate and you are doing the testing, please email info@collegetaiji.org, and that is where you will be able to get the test to qualify for the course completion. With that being said, any questions?
Hi, yes. Do you have any locations on the East Bay for beginner?
So that we do teach in the East Bay. There are a number of different schools that you can find out. If you're curious specifically about us, we work with the recreational wellness department at UC Berkeley, as Siwa mentioned. There is a program that is hosted by that program on campus at UC Berkeley that is open to the community. You do need to sign up though. But you don't have to be a UC Berkeley student. So you can look at that if you're interested. We're part of a martial arts program there at Cal Berkeley, and we do have classes that we do teach.
Okay, so unfortunately, the other classes I teach, which are free, are only available if you're a San Francisco resident. So we have free classes at the Buchanan YMCA. So those are free because we have a grant through AOA for all adults who are 65 and over, but you have to be a San Francisco resident. The second place that we will be doing is it will be at the Chinatown campus of the San Francisco Community College, and that's in the heart of Chinatown in San Francisco. Again, you have to be, I believe, a San Francisco resident. You can check that though by checking the website for San Francisco Community College and see if there are any resident requirements for attending the class. Again, I'm not sure. That will, however, not start until the fall of this year. So in September in the fall, those will be available through the San Francisco Community College. Those classes are also free. Unfortunately, those are the only classes we have, and we only have one class in the East Bay. So that's kind of where we are. Though we would suggest, if you're interested in Tai Chi, there are classes, for instance, at the Oakland Community Center, the Asian Community Center in Oakland, taught by Dr. Johnny Jang. And so if you're interested in that, those classes are through the recreation center there. So that's another place you can check. He will be teaching something different from what we're doing, but it is available, and that's through the Oakland Asian Cultural Center. Okay.
What about the Walnut Creek Conquer
So, without having to get into, because the purpose, we don't know all the classes necessarily that are listed from other schools that are hosted at East Bay, but these are just a couple suggestions. So the best thing to do really is to look online and to type in your location. But these are just to that question there, without having to go a little further, because we would love to be able to encourage you to keep your options open. So you don't have to necessarily go through us to find some options. But I put the link for Oakland Cultural Center, Seafood mentioned that. And then I did put the Recwell website for UC Berkeley. Again, by no means are these the only options out there, but we also do not have all the information of what schools
Right.
are
And
out there.
everyone may teach for a different purpose. So I kind of caution you, it depends on what you want to do. What we're teaching is specifically for health and wellness. Some teachers are teaching for competition or performance. So they'll be teaching a different material and based on whatever the requirements are. So ours is specifically designed to help with health and wellness and for acupuncturists and medical doctors. So keep in mind that's kind of different. You may find other Tai Chi teachers teaching something different, but again, it's because the purposes may be different. All right, so just keep in mind that's where what we're doing here is different from everybody else. Okay.
Yeah, we have time probably for one or two more questions. So, but yeah, if you have additional questions, you can always email me at taichi@ucmap.org. That is again, especially if you have any specific questions for us directly, we can follow those up later. But if there's no other questions, give a second if anybody's typing anything. Otherwise, it was a real pleasure working with you all today. Again, this will close the sessions that were part of today's therapeutic Tai Chi course. If there's anything else, of course, Christy will be able to answer that if you have.